Today we're going to be talking about heart disease and why it's important. My name is Dr. Isang and I'm a cardiologist using this platform to discuss your heart health and prevention. And one of the reasons that prevention is extremely important is that the things that you do now could potentially prevent a heart attack from happening. So if you understand what the risk factors for heart disease are, if you understand things like high blood pressure, smoking, diabetes, a strong family history, and not following up with your medical providers are all key issues in today's world. Weight loss, if you understand that and you start to attack that slowly over time, our hopes is that we can prevent a heart attack from happening. If these things aren't controlled, they can lead to heart failure, they can lead to strokes, diabetes, kidney failure. There's significant amounts of expenses you have to utilize to keep going. One of the things that we always say is that prevention is a lot better than treatment. So if you understand that, my father, my uncle, my brother has had a heart attack or had heart failure or had a stroke, we can understand the importance of getting this treated now, getting this treated earlier so that we can prevent this from happening in our life. So when it comes to heart disease, heart attacks, I think there are three things that always circle around it: high blood pressure, diabetes, and your weight. And the weight plays a huge factor because it can be a cause for all of the above. Your weight can lead to high blood pressure. Your weight can lead to making inappropriate food choices, which can lead to diabetes. Your weight, if untreated, can lead to things like sleep apnea, and sleep apnea has its own detrimental effects to our health. So it's very important for us to understand that weight, blood pressure, diabetes all play a really key big factor in our life, in our everyday living. So when it comes to our weights, especially if someone is coming to see me for first visit and they have something like heart disease or high blood pressure or even abnormal heart rhythms such as atrial fibrillation, I always shoot for 10%, whatever their weight is, to try to lose 10% of their weight. I find that a lot of people, after doing that, significant changes happens in their life, in their quality of life, sometimes even getting off some of these medications that they've been on for multiple years or even decades. So for instance, if someone is coming to me for, heart conditions or heart issues and they have sleep apnea, they have atrial fibrillation, they have this or that, I look at their weight, and if their BMI is creeping towards 35, honestly, if it's creeping above 30, but I try to give people the benefit, but if it's creeping upwards, I look at 10%. So if they weigh 280 pounds, my goal for them for the year is for them to lose 28 pounds. And easier said than done, but if you are honest with yourself and look at what you're putting into your body, you can start to understand your body a lot better. If you understand how much you are or are not sleeping, it can help for you to understand your body a lot better. There's so many fitness trackers, there's so many food trackers that you can utilize, and I recommend all of them. So, find the one that you understand the most and can utilize to track, how many calories you're taking in. There's so many gurus out here that can tell you how many calories you should be eating, anywhere between 2,000, 2,500, or 2,200 calories. But making sure that you're eating the right foods, making sure you're giving your body enough time without food to understand that insulin plays a huge factor, and insulin resistance, yes, can lead to diabetes, but it can be a precursor for things like atherosclerosis, which is plaque built up in the arteries walls, which can lead to heart attacks and strokes and everything that we hate that happens to some of our patients. So when it comes to blood pressure, you have to understand that blood pressure is a significant marker of health, so that if your blood pressure is starting to creep up, you have time that you can make lifestyle changes to help that better. You have to understand that the higher your blood pressure is, the harder the heart has to work. Over time can lead to it not working anymore. This is heart failure, or it can lead to plaque buildup. It can cause damage in the artery walls, which can lead to a heart attack in the future. So we all say 120/80, which is a good marker. And then also understand that if it's in the 130s, you can utilize lifestyle changes to bring that down. Weight loss, stress management, getting 7 to 8 hours of sleep, exercising 3 to 5 times a week, anywhere from 30 to 50. What I care about more is working out consistently. So if you can only allocate 15 minutes, but you can be more consistent with that, then do that, but also watch what you're eating. But if we notice that blood pressure is starting to creep up into the 140s, 150s, we may have to realize that lifestyle changes may not be enough. And there are a lot of different medications that we can utilize for blood pressure. They all work well. Issue is they all have their own side effects. So we have to choose the right medication for the right individual based on your side effect profile. Some can cause issues with potassium, ankle swelling, low heart rates. If you already have that at a baseline, so we try to avoid those medications unless you have low potassiums, because some of them can cause high potassiums and vice versa. Some of them can cause low potassium, so it may be advantageous to use that strategy also. We have to understand that some people have high blood pressure due to something else. This is known as secondary hypertension. One of the most common causes of secondary hypertension is sleep apnea, but we also have things like hypothyroidism, issues with your adrenal glands, issues with your hormones, menopause, perimenopause. So it's always important to follow up with your medical provider on a routinely basis to make sure that, that you don't have high blood pressure, and if you do, there aren't any other reversible causes of high blood pressure. One of my personal stories was that I had a patient that came to me on social media asking about secondary hypertension, and just listed out all the causes because they were on several medications and they were trying everything they could. So I mentioned issues with their kidneys, and they went and saw their medical provider, got an ultrasound of their kidney arteries, and found out that they had a blockage there. Blockage was opened up, and then boom, they were able to be weaned off a significant amounts of their medications. So secondary hypertension plays a huge factor into why some people have difficulty to control hypertension or just hypertension in itself. So understanding that and getting that treated, getting that under control is going to be one of the best things that you can do. And then the last thing that I always talk about is one of the most common things that I get consulted for is chest pain. So chest pain that gets concerning for a cardiologist is chest pain here, chest pain that gets worse with stress, or chest pain that gets better with rest, or medication called nitroglycerin. If you have any of those, go and get seen by your medical provider as soon as possible. Sometimes it may even be advantageous to go to an emergency department, because we'll run some tests, some blood work to make sure that there aren't any issues. We'll run an EKG. If you're still having chest pain with abnormal blood work and abnormal EKG, there's a high concern that you may be having a heart attack. We're going to take you to the cardiac catheterization lab, do a heart cath, look for potential blockage, open it up with a stent. If there's no blockage, of course, leave it alone. If there's a lot of blockages or blockages in scary locations, then we have to consider open heart surgery, coronary artery bypass graft, also known as CABG. But we understand that some people's chest pains, by the time they get into the hospital, their pain has gotten better. So we can do a stress test to look for indirect signs. We can also do an echocardiogram, an ultrasound of your heart to see how well the heart is squeezing. If there's any territory that's not squeezing appropriately, it can be an indirect sign that there's been damage to the heart. So if any of those are abnormal, we would then still take you to the cardiac catheterization lab to look for potential blockage. And a lot of times the echo is normal, the stress test is normal, labs are normal, and chest pain is resolved. We then want to, follow it up outpatient to look for both cardiac and non-cardiac potential causes. You can still have things like inflammation of the heart, pericarditis. That can be a cause of it, and that one is typically treated with anti-inflammatories. But we also have to pay respects to things like GERD, gastroesophageal reflux disease, pancreatitis, inflammation of the pancreas, cholecystitis, inflammation of the gallbladder. All of those can play a huge marker as to why you're having chest pain. So if we've ruled out all the scary causes of your chest pain, it may be time to look at potential non-cardiac causes. And this is why it's always important to not just have a cardiologist, but also have a really good primary medical provider who can continue this workup on an outpatient basis. And this is one of the last things that I do see that happens a lot. And anxiety can play a huge factor into it. I try not to let that be the first step or the first thing that I'm thinking about, because we don't want to rule out because I've seen someone as young as 23 years old have a heart attack. So if you're having symptoms that's concerning, go and get seen by a medical provider. If everything is normal, especially cardiac wise, where those non-cardiac causes have not been ruled in either, you gotta consider that anxiety can play a factor. So looking at the psychosocial issues that you may be going through to see if there's any changes that can be done there to potentially help you overall. My name is Dr. Isang. If you got any benefit from that, you can watch this next video on heart failure. It's gonna be put up at some point if it's not up right now.